Welcome to the Academy of Dermatology. I wanted to take a moment to tell you what I'm doing here. This is basically the industry's largest event with a whole bunch of top dermatologists, skincare professionals, products, lasers, new technologies, and medical researchers talking about what's new when it comes to dermatology. Cancer treatments, acne, scar removal, body contouring, even things like liposuction or Botox, which you know I don't support. I got to do live streams here. I got to teach people about skin. I got to interview some of the top dermatologists. And now for those who didn't have a chance to be here because you're not a medical professional or just weren't here, I wanted to film this video and show you 5 of the top things that I experienced and learned here today. So welcome to the Academy of Dermatology, and let's get down to what we learned. A dermatologist here who really believes in natural beauty and believes in kind of the same stuff that I do about prevention, and she's going to talk to us about skincare, about lasers, answering questions about microneedling, Fraxel lasers, skin rejuvenation. So Dr. McCrane, tell me a little bit, how long have you been a dermatologist for?
Well, I've been a dermatologist for 20 years already. Prior to that, I was a physician scientist, so I was actually in the lab for many years.
That's so cool.
And when I was only 12 years old, I became interested in finding plant-derived, non-toxic modes of pest control, so I was really into the environment and saving us from unnecessary chemicals at a young age.
A bunch of other people are asking questions about box pick scars, about deep scars, about if there's ways to treat scars without causing more scar formation. Let's specifically talk about the mechanism of scars, acne specifically, and then maybe you can advise on how to treat them. So from my understanding, acne scars are trauma to the skin. It is the pore that's inside of our skin fills up with pus and bacteria and oil. And as that explodes, it causes a lot of damage to the skin, which can lead to scarring. And scarring is this kind of knotted tissue that's very hard and lumpy. Sometimes it can be keloid scars, which appear on top of the skin. Sometimes it can cause the skin to tighten, and so it causes these divots or box pick or ice pick scars. And you can treat scars with over-the-counter products. You guys know that I really love glycolic acid, malic acid.
Yes.
A lot of these plant acids, which I'm sure that you use or are familiar with.
I do.
But there's also laser options because sometimes you can't get deep enough. We know that the skin has the epidermis, which is the top, has all these different layers, and then you've got the dermis at the bottom. And some of the worst scars go all the way down to the dermis. And sometimes skincare is not small enough or doesn't have the right particles enough to treat all of that. So let's talk about what people should look for in skincare for scarring specifically. And then number 2, Fraxel lasers. Is that the option? Are there alternatives to Fraxel lasers? What can be used to prevent problems in the future as well as treat existing scars? So any active ingredients you recommend?
Yeah, I mean, I thought one of the things that was brought up is the use of oils, and I'm very against the use of oils in people who are acne prone. Yes.
Okay.
One of the insidious causes of cystic acne in my practice has been the use of oils, which is a trend that has come out in the last several years. And the problem with oils is it doesn't happen right away. It'll happen after a number of weeks.
Okay.
So people don't relate that cystic acne to the oils, and unfortunately it's so deep-seated because the oil makes its way down to the bottom of that follicle that it's apt to scar.
Yes.
So that's that is not an active ingredient I would recommend using if you're prone to acne scarring. It's something I would avoid.
So something is interesting is that for me, I've struggled so much with my skin, and I actually currently use jojoba oil as a moisturizer and tea tree oil, and I really like them.
The reason those
But
two
is that
are,
not okay?
Those are exceptions only because they're both antiseptics. They actually have antimicrobial properties.
So I was onto something.
Yeah, and the other one is the grapeseed oil. But
that's okay.
Those 3 are the 3 exceptions to the rule.
I almost had a heart attack.
But what tells you how intelligent Cassandra is, because you figured that out on your own. And unfortunately, most people are putting essential oils that are very occlusive, and that's where the danger comes in. But you picked oils that have antimicrobial properties, which is really good. That's why they're good antiseptics.
But other oils are no-no. What about coconut oil? That's really trendy.
I know.
Is it not so good?
The problem is if you put it on the skin, it leaves a coating on the skin, so it can be occlusive.
So occlusive meaning blocking the pore,
Blocking.
which can cause acne.
So I would, I liked your ideas, and I want to just highlight those. And that is that you've discovered that fruit acids are very gentle yet effective. And I'm a big proponent of natural acids.
Yay.
So fruit acids, and glycolic is one. You mentioned malic. You know what else is good is citric.
Citric. Okay,
It
vitamin C.
happens to be really good for acne.
Okay.
I've tested a number of acids in my practice, and even though glycolic is great for lightening of brown spots, citric, mandelic, sal acid, of course, happen to be very, very good at controlling sebum and getting into the hair follicle and into the oil gland of the follicle. They have a very efficient way of getting in there. Those three acids actually work by tracking themselves into the oil glands.
And stopping that oil from overproducing or creating the inflammatory cytokines, which are basically like inflammatory little soldiers that just cause issues.
And fatty acids are a problem.
And fatty acids.
Because remember when you explained how the cyst bursts?
Yeah.
It turns out we've learned that it's the fatty acids that cause the inflammation sideways that ultimately cause scar tissue to form.
Wow, which is why using a bad oil just increases the problem.
When it comes to acne scars, I have to tell you, retinoids on a regular basis for people who have significant scarring do reduce the scarring over time. You do get a chronic peeling effect.
So then when it comes to taking that to the next step, let's say that you've already tried a lot of these active ingredients, what are options when it comes to lasers or treatments that work and what doesn't?
Fraxel works by creating a layer of scar tissue on top of the skin. That's basically how it works.
For anybody who hasn't seen Fraxel, by the way, after this live stream, you should just Google it. It's basically, they shoot frequencies and light and energy at your skin, and it looks like
little
snake
columns.
skin, and it like burns it off. But then continue.
Perfect. You're making little columns of burns. It works great for fine lines, really great for aging of the skin. But what I find is that with the acne scarring, it just kind of softens the edges of the acne scars, but it doesn't get at the crux of the matter. I like things that are gentle. I don't want my patients to have downtime, and I certainly don't want to cause more harm to skin that's already been harmed.
Thank you.
So I like devices that work internally to get your stem cells to do what it needs to do to repair itself. Now, Genesis is one that you've heard about because a lot of the models use it. It's well known that I take care of the IMG models.
Yeah.
A lot of them are teenagers. They have acne and acne scarring, and I've got to get them looking good by the time of their casting the next day. So I love to use the Genesis for that. It helps shrink the oil gland down. So if you have existing acne plus acne scars, it's a great choice. And it shrinks those oil glands. It shrinks the redness from your acne, but then it also gently stimulates your cells to make collagen. And it does so without burning the skin.
Okay.
That's why I like it better than Fraxel. The Pico Genesis I'm working with now for more of those ice pick scars, I find that it works really well for those superficial scars like the ice pick or the large pores to shrink those down.
So that's what I was going to ask, because when it comes down to treating acne scars, if you do something like a Fraxel laser or something similar, you're burning off the skin. Now, from a physics standpoint, my understanding of the Fraxel laser is that it shoots energy in a cone-like shape. Remember, our skin has a bunch of different layers. Down here at the dermis is where we want to treat. Up here at the top is the epidermis that slowly sloughs off. The Fraxel lasers shoot light and energy in a cone shape, which means at the top, you're destroying all of the epidermis and you're getting only a little bit that point down at the bottom. Now, I know that earlier I was learning about Secret by Cutera, which is radio frequency. It combines laser technology and heat and energy technology along with microneedling. Microneedling is a whole nother topic, but it's this idea that if you're able to take that energy from a laser and put it into the skin in a healthy way, you don't cause that damage, but you're boosting up that collagen. One thing that I'm really huge about that I say all the time is that our bodies inherently know what to do.
Yes.
They know how to take care of themselves, but sometimes things go wrong. Sometimes hormonal things happen, or sometimes we even put skincare that gets in our body's way. But using laser technology, and specifically this Picogenesis laser, like you said, is stimulating the body's own natural immune system. So it's really lending a helping hand to let the body do what it does best.
I just love what I'm hearing from Cassandra, because I've been saying this in my own world for decades, which is that I just help the skin do what it needs to do to repair itself.
Because We know
Mother
how.
Nature knows best. So what I like to focus on is stimulating your stem cells to do what your skin was destined to do, what was programmed to do.
Okay.
That's why I want a natural outcome. And natural means that you look like you don't look like everybody else.
Okay.
And I find that when people are overburned with lasers that create a layer of scar tissue, everybody starts looking weirdly the same because their skin starts having a plastic appearance. What I like about devices like the picogenesis that go under the skin and gently stimulate your own stem cells, your skin produces the output of what makes you look like you. And you just want healthier, younger looking skin of you, but your own skin. You don't want somebody else's skin.
Does anybody agree with that? Tell me yes or no. And then you said something that if you do too many things, people start to look plastic. I really want to talk about that because especially being someone who's on social media, we see a lot of the Kylie Jenner lips.
Yeah.
And don't get me wrong, people like that are gorgeous. But at the same time, being someone who's a science girl as well, high fives, I've looked at I've looked at some of the active ingredients in these things and some of the long-term repercussions of things like Botox, and I'm just like, I don't know how I feel about that, and I can't recommend that to other people. So let's get really honest here.
There.
Plastic surgery is all over social media. I believe that a lot of Botox treatments can be potentially harmful. Botox, for those who don't know, is a muscle relaxer, it's a paralyzer, which is injected into your skin using a needle. The doctor pushes it around, and it stops your muscles in your face from working. Like when you lift and you have a bicep, it stops that from working. So therefore, you can't even look surprised or smile because you're paralyzing the muscle, so it doesn't cause wrinkles. But there have been studies that I've looked at that show that it can be toxic, that it can stay in the body, that over a long time it can have negative results. And then if you want a facelift for anti-aging or something like that, you need to literally cut open the skin, pull back the loose skin and make it tighter. And I have to be honest, I don't want plastic surgery. I don't think that that's something I'm going to do. But I'm also saying that as a 25-year-old, in 20 years and 30 years, am I going to feel different? Now, if I have these concerns, are there options that I don't have to cut my face open or inject myself with needles? What are those?
Okay, so now we do get to the preventative.
Okay.
You can do preventative care. So topical therapy like the actives, which prevent aging in the skin, correct the mutations caused by UV light as they occur in real time using DNA repair, which are C extracts that I have in 37 actives.
C extracts meaning like marine
red algae,
biome,
blue algae, plankton, Arabidopsis, and Micrococcus. They have DNA repair mechanisms, so then you're repairing and preventing. And the other is using devices like picogenesis, which gently stimulate your stem cells to do what they're programmed to do. So you maintain collagen levels in the long term. That could be preventive. You start to see some fine lines. You could do something like that, and it really will eliminate those fine lines and prevent aging from progressing, because something like picogenesis works for 12 months. So what I'm trying to say is the nice thing about devices is that they are money in the bank for the future, because your skin will continue to age in reverse out to 12 months after your last treatment.
That's so interesting. First, let's start talking about our bodies. We all want to love our bodies. We all want to feel empowered and great, but I'm not gonna lie, there are times where we don't. I've had a history in the modeling industry where unfortunately things aren't always as inclusive as they need to be. And even as someone who's happy with my body, there are certain areas that I don't feel confident with. And online I get a lot of questions about that kind of stuff. And I have to be honest, in the blogging sphere, I talk a lot about positivity, about empowerment, about skincare and education. And I'm a huge advocate for healthy diet, healthy exercise, even exfoliating certain areas of the body and skincare. But sometimes that's not enough. Can we dig in on a medical perspective why someone can have a baby and lose 50 pounds but still have fat in certain areas? Why does that happen? Why does it stick there? And for somebody who is genetically prone to holding fat in certain areas, even if they lose weight elsewhere, what's available that's not gonna hurt or cause pain or injury?
Well, to your first question, genetics has a key component.
Okay.
Because sometimes we just develop fat in certain areas and you can't exercise it off.
Yeah.
And then the second consideration is the hormonal insults of pregnancy cause you to put fat on in certain areas, which is, basically to keep our species alive, to make sure that you have enough to draw on to feed your baby, and so you kind of pack it on. And then after the baby's gone, sometimes it doesn't always go away so fast, or because of the space that the baby took up, the skin condition isn't at its maximum.
Yes.
And so it's a big concern for women post-baby. There are a lot of options that we never had before. Specifically, though, we wanted to talk a little bit about this new system from Cutera called TrueSculpt 3D, which is a way of heating the skin and achieving our goals, which is to remove some of the excess fat in the pockets that we can't get rid of it, but also to improve the skin quality.
Wonderful. So one question that I have is concerning fat cells. And for anybody who maybe doesn't understand the body and chemistry and biology, correct me if I'm wrong, but fat cells are like balloons. We are born with a certain amount, and those balloons either grow or they shrink, depending on whether we eat a lot or depending on our hormones or what we do to exercise them off. Now, other treatments such as liposuction rip into the skin and actually vacuum those out. But this treatment and some treatments that are available either work by cooling, which can freeze fat cells, or here, actually heating fat cells. So explain to me how and why heating a fat cell would help remove them.
Well, basically, if you heat a cell to a certain degree, it can become basically no longer viable. But instead of like burning it and sizzling it, you actually heat it just to the degree where the cell can't recover.
Okay.
It's a process called apoptosis, where the cell kind of gently passes away in a way, and then it extrudes its contents, but the body actually takes those contents and breaks it down just like when you digest something, and uses it for other parts of the body. So it's not a violent process. There's a difference between this and exercise.
Okay,
burning
please.
the fat is shrinking the fat cell to its maximum small amount. But
And here
this
you're removing
process, this process is actually getting to the point where the membrane of the cell can no longer be viable. So it actually is removing the cell itself.
That's amazing. And I think that's really the basis of it, is feeling strong and empowered and loving your body,
Right.
regardless of what it takes to get that for you, which will be different for other people. So next question, who is this not appropriate for? Because there are some people who have certain areas of fat or certain genetics that this will not work for. And I think it's really important to make sure that people talk to a board certified dermatologist or somebody who's a professional, so that they don't get sold a product that won't work for them. Who is this for and who's it not?
I think who it's not for is anybody who's probably 20% above their ideal weight.
Okay.
Because this isn't a diffuse thing. This is a shaping, sculpting. That's why it's called TrueSculpt. So it can be used on the abdomen. It can be used on the legs, which is another area that people don't like. On the arms, bra fat, chin, all these pockets that tend to like get a little bit bigger. But if you're diffusely large, you really need to tone up and lose weight first. Then when it becomes apparent that there's certain areas that are difficult, then we can approach those areas to smooth them out.
No, I always tell people this, is if you can grab an area with your hand, you just say, hey, can you grab an area? If they can grab it in their hand, it means they're probably going to be a candidate.
Not this much.
If they go like this,
right.
If somebody comes to me and goes, hey, I have the problem here, say, no. If you can, you want to grab a
I
hold
think
of
if
that
you can
pocket.
pinch a couple inches,
Right.
that's good.
Yeah.
But if you start needing to pinch a whole handful, you could whittle away at it, but it's not like you're going to go from that to.
And this isn't like a 50-pound weight loss type of thing.
This is not a weight loss.
Perfect.
Correct, yeah.
Perfect. Basically what we're doing, introducing needles into the skin, the body is creating an inflammatory response. Like if I accidentally cut my arm jumping over a fence because I'm crazy, my body would naturally heal that, but it would leave a scar. Now, because these are microneedles, it's a little bit different, correct?
Totally different, because the microneedles are so small, they go in and they really don't create an injury like you were talking about with a cut.
Okay.
They actually just slide right in. And it's amazing. So when you do that, just if you take a very tiny needle, you don't get a little injury there. In fact, when you create that type of injury, your skin improves, right? And this has been proven time and time again with lasers, with other devices, that if you create a small enough injury, you'll actually make the skin look better in the end.
So is any blood drawn with Secret by Cutera, this microneedling technique, is any blood drawn?
So, no.
No,
So,
cool.
because as Dr. Bhatia was saying, these needles are tiny.
Okay.
And what's unique about the Secret by Cutera is that it's not just microneedling. We actually couple microneedling with controlled deep delivery of controlled amount of radio frequency
Got
deep
you.
into the dermis. The two modalities combined together is going to give you a lot more of an outcome, a lot more visible outcome than you were doing just by microneedling.
Got you. So what's different about Secret by Cutera is this idea that we're going beyond what we just discussed, regular microneedling. So on top of these needles going into the skin to stimulate collagen, you're actually introducing what's called radio frequency, which is it light, is it sound? Talk to us about that.
Well, radio frequency is actually a controlled amount of electrical current.
Cool.
So when that current hits your skin tissue, it creates heat.
Yes.
And that heat's the magic. The heat's what's going to create and build collagen, it's going to create and build elastin. It's what's going to really revitalize your skin.
Okay, so with Secret by Cutera, you can kind of, I guess, think of it the way it's been described to me as, think of like lightsabers, like needle lightsabers
I like
in
it.
Star Wars
Right.
that have this radio frequency. So when they go into the skin, they're not only puncturing and creating
Right.
that needle point like many other treatments
Right.
do, but it's introducing radio frequency, which really heats the skin from the inside out
Right.
to stimulate that healing.
Yeah.
Precisely.
Now here's
Very well.
the hard question. I'm a blogger. I love DIY stuff.
Right.
My audience does as
Right.
well.
Sure.
There are a lot of microneedling
Oh,
options
yes.
that
Oh,
my
yeah.
audience has brought to me. They said, I found this roller online. I used it. It was ruining my skin. Or I used it. I got amazing results. Tell me, how is the Secret by Cutera different? Is microneedling online at home safe? What should people know? What are the biggest differences?
Right. I really want to warn the audience about using microneedling at home.
Okay.
As I said before, there's so much variability in terms of what the needles look like.
Got you.
It could be very damaging if they're too dense, if they're too thick, if they're too long.
If they go too deep,
That's right.
if they're too thick, yeah.
And it actually creates, instead of revitalizing your skin, it's actually damaging and injuring your skin.
Okay.
We've seen some terrible, terrible aftermath of these DIY projects at home. So please, please, please be careful. So what's so different about the Secret RF is that the needles, we know precisely how small these needles are, how many times it goes into the skin, how deep it goes into the skin.
Okay.
So that control knowledge, that control amount of revitalization is something that's very, very precise. Far more precise than you can do anything that you can do at home.
Yeah. When we're looking at somebody's skin, we look at the oiliness of the skin, the thickness of the skin, what we're treating, right? Are we just trying to rejuvenate the skin, or are we actually trying to improve scarring?
Yeah.
Because there's a lot of people, with acne, they have some scarring, and that may be what's really bothering them. There's so many, there's all the layers of the skin, and there's damage at different levels.
Got you.
And what we're able to do with this treatment is actually precisely target where we know that damage is, and then apply the energy, the right amount of energy, and the right amount of needle-based injury to really get the results that the patient is desiring, right?
That's interesting. I've studied a little bit because I'm a nerd. Just dressed as a mermaid. And let me explain the way you described the Fraxel laser and the Secret by Cutera, and tell me if this is correct or not. So when it comes to a Fraxel laser, it shoots, light, essentially. It shoots these frequencies in like a cone shape. So as a cone shape, it is trying to get as deep as possible, but you have many layers of the skin. The epidermis is at the top, the dermis is at the bottom. When it shoots this cone shape, does a lot of damage up here, and then only a couple of those things actually get deep into the skin, which is why you have this burning of the top layer of skin and a lot of downtime. Now with the Secret, you're actually penetrating the skin, so you have needles within the skin, and that's where you're shooting the light out. So instead of having it like a cone, it's reversed, it's like a pyramid.
That's right.
And so that's why there's no downtime, because you're creating this stimulation from the inside out instead of from the top bottom.
Exactly.
So then the next question that kind of, sorry, I got a lot of questions. The next question that comes with that, is with how the skin actually rebuilds that collagen. Because when it comes to acne scars, the pitted, boxed ones, or for wrinkling, such as deep wrinkles and canyons and divots, you're basically telling the body, recreate your own collagen and actually create new fibroblasts, which are like the rubber bands within your skin, to tighten them up and to actually produce more. Is that correct?
That's correct.
Okay. And how many treatments does it normally take to do that? Is it vary per person? How do you know if you're going over?
So typically we'll tell patients that it'll take 1 to 2 treatments to start seeing the improvement.
Okay.
And, our typical treatment protocol is 3 treatments.
Right.
So
Only 3?
Yeah, it's only
Okay.
3 treatments. So I know we got a question on boxcar scars versus the
Ice pick
scars, right? So what this is ideal for in all of these treatments which remodel the skin, you were talking about fibroblasts,
Yes.
right? So they cause some heat injury, which causes these fibroblasts to get stimulated. But also another thing it does is that scarred type collagen,
Yeah.
it actually helps break that up. And so there's two components to it. You're actually what we call remodeling the collagen. You're breaking down the scar type collagen and you're stimulating the body to replace it with natural, healthy collagen.
That's amazing. So if you have a scar, or if I have a scar that's like misshapen or overdone,
Yeah.
then you can actually disintegrate it and the skin rebuild it with these.
In fact, a lot of these rolling scars, they're kind of bound down because what's the difference between scar tissues and healthy tissue is we call it like a basket weave pattern of collagen. Normal collagen is like a nice basket weave. When we look under the microscope and we see a scar type collagen, it's like a thick rope.
Wow.
And so that's what's pulling down and kind of when people speak, you can actually see more of their scars because they're moving, and then the scars are actually hard and they get pulled down. And so it really makes sense. And what we want to do is get rid of those hard ropes and replace it with healthy, soft collagen that moves naturally when we speak. And that helps improve the look of the skin. And that's what we're doing. We're actually turning this all over.
To help me understand and to help everybody understand a bit more, even if you do have an issue with keloid scarring, that's why it's important to talk to a dermatologist, because this Secret by Cutera punctures the skin, introduces this radio frequency, which can help with acne scars, with pigmentation, and with wrinkles.
That's right.
And tell me, does this cause downtime? There are other skin treatments. If somebody is especially interested in removing wrinkles or aging, there's facelifts and plastic surgery that requires you cutting into the skin and pulling it back.
Right.
How long does this take?
Right.
Is it painful? How does this compare?
Right.
It's a very comfortable treatment. It's a quick in-office treatment, so we're not going to the operating room or anything like that. It takes about 15 minutes to do a treatment. And as far as pain control, you're right, there are tiny little needles, but really most people say it really doesn't hurt. It's very comfortable, especially compared to a lot of the laser treatments and other things we do. People find it very comfortable. We do usually use a little topical numbing cream.
Just in case.
Yeah, just to help a little bit with it, and that usually takes care of it. Now they do feel a little bit of heat because we are generating heat.
Warm.
Yeah, so you feel the warmth.
So if I were, because I have acne scars that again remind me of when I was younger.
Yeah.
If I were to do this, am I going to have to sit in bed for a week? Can I go out the next day? Like, what am I because it's not drawing blood, but like I'm very leery of some of these things, and as I'm sure other people are as well.
There's just a little bit of redness afterwards, and some people get a tiny bit of swelling. So usually what we'll tell people is just for that day, kind of keep your head
for
up.
One day? Okay.
Yeah, but they can go outside, they can put on makeup. And,
put on makeup, okay.
And
wow.
And
Yeah,
cover
and
up.
for the most part, everybody goes back to their average activity the next day.
That's amazing.
100%.
Another advantage of the Secret RF over Fraxel is that the Secret RF it's colorblind.
It's colorblind.
It is not it does not discriminate based on
That's
age or does not discriminate
great.
based on color.
Right.
When it comes to Fraxel, because of who I am, or who Dr. Bachi is, we oftentimes
Genetics.
get genetics.
Yeah.
We oftentimes get Asian patients to come see me because of who I am.
Yes.
And we have to be very, very careful using a laser device because oftentimes you'll get something called post-inflammatory hyperpigmentation. Your skin actually changes color unintentionally based on these laser technologies. The Secret RF, you're not going to have that problem.
Interesting. So to kind of recap, there are different types of skin, and certain people who have certain genetic predispositions and have maybe darker skin are prone to having more damage and pigmentation. So taking a micro roller that you get online could actually cause 500 small scars on your skin if you're prone to it, which is why it's important to know the difference. So guys, I really hope that you enjoyed this video. I hope that you learned something as well. Again, just speaking about skin and about science is so empowering. I believe that you should know what's available so that you can make the best decisions for yourself and know how that's going to work for you and what to ask a doctor or a physician when it comes to taking health into your own hands. So again, I hope you had fun. Be sure to let me know if you did. If you have any questions, post them in the comments below. I've connected to a lot of great people today who I would love to source and ask questions to. So if you have a question that wasn't answered, let me know what they are and I will reach out to some of the people that I met today or some of my old contacts and try to get you those answers. There's actually the dermatologist that changed my life, the only dermatologist that ever took me seriously when I was talking about my skin and food. She's an Indian dermatologist, Sonia Badrisha Benshal. she's here somewhere, but I haven't been able to find her because it's literally huge. So I'm gonna continue stalking the arena. I'm gonna continue trying to see what I can find. And again, thank you for spending time with me. I know your time is precious. I appreciate you being here, and I appreciate you taking the initiative to help yourself and improve the world for yourself and those around you. Mwah! I love you guys, and I cannot wait to see you all in the next video.